Well, hello, my name is David Schwartz, and I wanted to make a video today. It's not my first video. I've done other videos on YouTube that were about how to make money taking surveys and showing me doing VR of the PlayStation, VR, and stuff like that. And I feel like I wanted to do a video that is a little different. It kind of speaks to the journey I've gone through in the recent past. I know I've talked about it in an earlier video about having autism spectrum disorder or Asperger's, and I wanted to talk about that, something that maybe could help others if they watch this, and maybe it can help them if they're having a hard time talking about it to their family or just dealing with it in general. Because when you have autism, specifically, you could have comorbid, like, or at the same time, like it can be with, in addition, the anxiety or depression. And the anxiety for me has really been like in the last, especially in the last like couple years, gotten really bad. And let's say in the last 6 months, to the point where I was having so bad the chest pains and calling 911 and being on different medications that apparently starting to get these bad side effects that were causing uh, worse anxiety, maybe a little depression, but it was so bad that I did not know what to do anymore. And I was so hopeless. I was feeling so bad. And it finally led me to something that I had actually looked at a while ago, but there really wasn't much of opportunities to check it out nearby where I live in Miami, Florida. And I'm 54, by the way. So, I guess I'm kind of middle aged. But I found what is called TMS, which is transmagnetic stimulation. And it's where they basically put magnets on your brain, and it's supposed to help. Well, it can help with anxiety, depression. And I was thinking, like, recently, as me and my wife, we were looking up things I could do or places I could go, even looking at psychiatric hospital, and just at my wit's end, and having been in the hospital emergency room a few times because and was finding different medications that were causing side effects that I was getting off of, and finding like temporary relief. And so finally found a place that's called GIA Miami, and you can look them up. I mean, I really have to say that they helped me out so much, and being able to set up a payment plan and having the 24, it was basically 24 sessions of TMS. And then you would, the idea is that you would go through a maintenance after that. And it's just amazing what it did for me. I started doing it, and and somewhere in the middle of the sessions, I started to feel like something just was happening, and it was a positive thing. And it finally got to at the end of the 24 sessions where I felt such relief of anxiety, and um, just amazing the transformation that it was, and my family could tell you and stuff. And then about a month or so after, I just started to feel like anxiety kind of coming back, and I understood that that could happen. And there's a chiropractor that I had been seeing for many years, and he wanted to try something on. It's called a PEMF machine, and it's similar in how it operates, but not exactly the same thing. But it does put impulses into your body, and I tried that for a little bit, and really not getting the results until I realized, I need the TMS again. And ever since then, it's been really hard and trying to, because in the maintenance, it's about, well, I was doing twice a week, now it's once a week, and it feels like it's just not enough. I feel like my anxiety is there just too much of the time. And it's so hard. It's like, it feels like it almost like strangles me when I try to focus on doing things sometimes, I can't seemingly tell myself, oh, well, it's okay. I'm not dying. There's nothing wrong, nothing seriously wrong. And I'll feel aches and pains in my body. I get physically ill, kind of, and I'll get like indigestion or I get different symptoms. That it's amazing how you can get this from anxiety and just not knowing what to do. And I know all the things that they tell you. Like I see a a psychologist. Sorry, I'm looking into seeing another psychiatrist just in case to have the clonazepam, which is the anxiety medication. But a psychologist, and and they tell you take deep breaths, you try to restructure your thoughts. I mean, all these different things, and it's just amazing how hard it is when you can't focus and you can't focus enough to even stop and think and say, wait, you know, I have tools here, and you almost don't realize that you could try taking the deep breaths. I honestly have at times, and can't always say that it's helped. Sometimes even taking the anxiety pill, it doesn't necessarily help like the first, like say dose or whatever I'll take. And it can be just like an aggravating and just like you don't know what to do when you can't like function. And then when you're not able to function, it's almost like you can't think straight. And then there's times where I almost don't even realize, oh my God, it's at a point where I should be eating. It's time to maybe that I should be having breakfast or something, and I'll see, well, what time is it? And think, oh, well, that could explain something, and trying to realize, what exactly is going on. And there is a way to like test, I would call it. Like my chiropractor has a way of doing it, and my general doctor has a way. But there's a way to test where you can like you could like say you stand up, and then you can ask sort of like to the universe or whatever, um, which direction is going positive for me. So it would mean moving forward or backward, and then you say which way is going negative. And let's say I'll ask questions like, do I have anxiety? It's almost like, okay, yeah, you could probably or should be able to know what you're feeling, like if your chest is hurting. But let's say, for instance, you don't feel chest pain. You just feel like, oh, my back is hurting me, and I can't explain why. And so I might want to ask, oh, do I have anxiety? Okay, maybe I get a yes in the testing, depending on which way is positive, the forward for me, which is positive. And then you might ask, well, is anxiety causing my body aches and pains? And for me, it's not been a surprise that I've gotten yes quite a few times. And so it's like amazing, you say, wow, that's causing that. Now, how can I alleviate it? Or if nothing else, you want to try to deal with it. And that is the hard thing, is to try to deal with it. If you're able to think rational, if you're able to stop for a moment and stop like your thoughts and stop yourself in your tracks and say, wait, okay, this is going on. Okay, I got to tell myself, wait, this is nothing serious. And okay, and maybe take deep breaths or maybe just restructure your thoughts to get yourself to realize, hey, I'm not in serious danger. I don't need 911. I'm going to be okay. And I can get through this. And just like, if for any reason there might be something you can think about at that moment that sounds pleasant to you, honestly, whether it might be, oh, I'll have a cup of coffee, or um, it could be if you like watching videos or movies or TV shows, like whatever it might be, or a hobby that might give you interest, you might have an interest, you know. But for me, it's been very difficult a lot of times to be able to think clearly, straight, or whatever, to be able to stop and say, oh, yeah, let's do that. And I'll just be there, like in this almost like a hell. It's like of a world that I don't know what to do. And yeah, sometimes I will maybe call my mom or somebody, like, or if somebody's here at the house, like my wife or whatever it is, and say, well, what can I do? Because I honestly sometimes don't even trust when I test myself, but it's it's trying to get to accept that, hey, I can handle this myself, and I can test, and if I feel like that's what I want to do, and trust that. But really, try to get to where you don't have to do that and just be able to recognize, okay, this is happening. This is almost certainly going to be anxiety, or maybe it's nerves or whatever, and I just need to stop. It's almost like when they say when you're going to cross the street, stop, look, and listen. You know, you're going to stop, you look around, make sure that left and right that there's no cars coming, and then listen for any noises or anything that shows that something's coming, or and should be able to do that and stop and assess assess the situation and be able to, like take deep breaths, or just say, look, this is okay. My body is wanting to give me these physical signs, symptoms of things of like the anxiety, and just I need to just keep going. And there's times that I have done that, but then there's times where it's just very difficult. And so I am right now in the maintenance phase of the TMS, and when I've done this like testing, it does show that it is going to help me again. Eventually it's just taking longer time because it's, once a week as compared to I was actually going 5 times a week for 4 weeks. And there is supposedly a memory that the TMS, it's like the brain remembers, it's got a memory for when you're doing the TMS, like, and it's got like a thing in the back of your head that's hitting, you feel like a clicking sound. And so you don't really, you're not supposed to need to go through the whole thing over again. It's just, if you understand, once a week of this magnetic stimulation, it's going to take more time. And of course, I could get frustrated and feel like, hey, it's like I want this now. I want relief now. And of course, there is the anxiety pill, which I have to say, sometimes it does help for sure. If not one pill, maybe I need another half, and of course, for some people, taking a shower can really be helpful, something like that. There's all sorts of different things, and each person can find their own thing. And I like VR, for instance, so sometimes I will get on virtual reality, my headset, and that can be enjoyable. And honestly, yeah, I mean, I don't know if and what I'm saying resonates with a lot of people. I don't know, because I'm saying how I'm kind of like in a process right now, state right now of like kind of struggling again. But I know that in the end, and you have to tell yourself that you will get through it. And there's times that I can tell myself that. And if I don't get reminded by my mom, dad, or family at times, which is always great when you have family to help be there for you. But I know that deep down, if if I'm ever for whatever it might be, 5, 10 minutes, and I'm struggling and I'm feeling this pain in my body, or I'm feeling like an indigestion, or I'm feeling like, what's going on here, and I and and I'll go in and maybe start doing some testing, like I mentioned before, and try to figure out, okay, and it can help sometimes for me knowing, oh, okay, well, if I can believe what I'm testing that it's anxiety, okay, so it can be a little bit of a relief to know at least what's going on, as opposed to, oh my God, I feel my chest hurting maybe or something, and I just don't have a clue. And I'm thinking it's the worst thing. The world is ending. I need to do something. I need to call 911. I mean, I can't take this anymore. But uh, ever since going through the TMS, the initial 24 sessions, no, I have not gotten to that point of feeling like, oh yeah, it's 911, whatever it is. No, I mean, I do eventually, my brain eventually works through a whole bunch of things, like doing computation, like math computation. Eventually, it does get to where I start realizing, well, there's certainly I could take a pill. I might not really like to. I don't like to put more medication, more and more like stuff in my body like that. It's natural, okay. And my chiropractor has certainly been great in giving me certain things to try to help get toxins out of my body. There's like a nasal spray that I'm doing now, and there's other things that, and supplements that you can take. They can be for calming. You know, I actually had a trouble in sleeping, and I was doing melatonin, but then with the TMS, it has made it so I don't need the melatonin anymore. So, but sometimes you take like natural supplements. Certainly, I can't argue with that. I would, I take an immune supplement, and So I guess the screen went blank for a moment. Okay, it was interesting. Did not expect that. So yeah, so I take an immune support, and fish oils and different things, and a multivitamin, and I totally agree with that. But if if I have to for like the pain, I have taken a leave before, but if I'm understanding that it's coming from like something that's like anxiety, that's like a mental, that's like an emotional thing, and also knowing that my Asperger's or autism can definitely make things worse. That's for sure. On testing, and just I just know, and I also know. Well, there is somebody on YouTube that I followed for quite a few years, which is Daniel Jones of the Aspie world, and I've given him like a shout out before, and I have to say, he's kind of an inspiration to me because I watch his videos all the time, and it's great when he gives tips on, on on on, on like dealing with autism and stuff like that. And I, have to say from through him, like it got me to start doing videos because I felt like, oh my God, it's a scary thing putting myself on camera, which didn't in the end. Most of the videos I ended up doing on how to make money taking surveys, I didn't really have to be on camera, so that was nice because I wanted to show the website that I was focusing on. So yeah, that it didn't really matter, but I'm showing my face now, and yeah, it gets to be a little nerving, get nervous, and of course my Asperger's autism, I really it's like I don't know which one I should go with because right now it's autism spectrum disorder by the DSM-5 and the psychology handbook, but so that definitely makes things really more difficult as I have social anxiety too, and trying to like say work at a job which because of the TMS I did recently go to apply for at least apply to a job again. Felt a little bit more confidence in that and had a few job interviews, which I thought I did really well. And so I have gotten some confidence in some of those areas. And just happened to be that they were looking for something different as far as the amount of hours, because I'm only able to work a certain amount of hours and so forth. And so, you know, but but this Daniel Jones, I have to say, has helped to some extent, at least, in getting me like a jump start. And this is way before the TMS when I found him, and you know, but the TMS, to say the trans magnetic stimulation, has definitely opened doors for me. That still, I'm definitely not where I was like about 3 4 months ago when I was so strangled like with the anxiety that I couldn't. I can at least do plenty of things, and if they called me tomorrow for a job, I could certainly see myself, going through the motions of working and seeing how it goes. I wholeheartedly can see myself, getting to that point. But you know, I'm here. If they ever make the phone call, and so yeah. So I don't know if there's that much else left to say. Um, I don't know if I might be missing anything that I wanted to touch on, but I have been doing for many years taking surveys, and that's why, of course, led me to do videos on how to make money taking surveys because it really does help for sure. I have some surveys sites that I'm on right now that are like really paying, I mean, when I say paying pretty well, I mean, hey, if I can get every couple of weeks or even a month a $50 PayPal and another site, let's say I have enough rewards for um, 25 like 10 $25 gift cards. It's just that they only allow you to redeem so much, but most sites you can redeem as many points as you have. And so that I can only say, if anyone is interested in that, check out my other videos. I have like 17 videos on different survey sites that can help you make extra money. Because I through actually through Daniel Jones, like through getting inspired from him, I wanted to do those videos, and I finally got myself to just say, I'm going to do it and put them out there, and hopefully people will see them. And one of my videos does have over 500 views, so apparently one video, it struck a nerve with some people. I don't know how people have found that video, It's the number 15, I believe. And yeah, so I have in the last few years, it's like started where I just felt like, I wish I could do something. I wish I could be more productive in my life and help people. And then, of course, just recently with the doing through TMS, thinking, oh, if I get a job and be able to be productive for myself, because that was another thing that TMS has got me more confidence for myself and not think of others or not be like wishy-washy and be able to stand up for myself and be able to defend myself and, you know, be more, you know, because I don't want to say like to be more, well, I guess be more of a man in a sense because I am a male, but just to be more, um, just stand on my own 2 feet, and be able to say, hey, I want to do these things, and so I'm going to do it, and be more proactive, and not just sit there on the fence and, you know, I at least, sitting there and just being too scared, and letting anxiety or whatever get to me. And so, yeah, so I would just say, whatever you're going through, and of course, anyone who has on the autism spectrum disorder, you know, it's not easy, and certainly anyone could tell you who suffers from that, and of course, including Daniel Jones. I mean, he really, I would really recommend you watch his videos because he can speak better than I can. I think when it comes to all that kind of stuff, and he does, and he's really come a long ways. He does so many things. He's a musician. He wrote one book at least, and yeah. So, um, but not discounting myself. Okay, I do feel like I want to say, hey, don't forget about me in all of this because I'm the one doing the video talking about myself, my sort of like recent journey. And please check out my other videos because there's some interesting ones where I do uh, on VR Beat Saber. I even do some VR golf and other things on VR. And of course, if you want to make extra money, check out my videos, check out my other videos that I've done. And well, I really hope that this video can help somebody. Um, and you know, so I don't know, maybe this might lead to more videos on this topic, but I'm certainly not trying to be somebody else. This is me, David Schwartz, and uh, yeah. So just check me out on YouTube, and maybe I'll be back soon. I might even do another video on how to make money taking surveys if I find another site that I think is worthwhile to put up. And yeah, so I hope anyone watching this has gotten something from it and enjoyed it at all. Uh, and yeah, okay, well, it's been nice being able to speak, speak for myself, being able to, you know, put myself on camera. And yeah, I feel pretty good right now, actually. And okay, so till another time, possibly. Take care, everyone. See you. Bye.